everybody. Thanks for joining us again. As you know, we'll be coming to you live as we have been every Wednesday. Today is our telephone town hall and Facebook Live event, and again live on Facebook on Friday. So we'll be with you on Wednesdays and Friday of every week. Every other week, a telephone town hall. And tonight, if you are joining us, this is County Executive Mark Molinaro. We'd like to give you a bit of a COVID-19 update. If you're on the phone call tonight and have a question, dial 0 on your phone. You will be sent to a voicemail system, and then we'll take your question. When we call you for your question, you'll be live on the call. And I did promise, and I want to keep my promise, that we try to get through as many of the phone call questions as we can. We've had obviously trying to get to both Facebook questions and the telephone questions, and I want to be sure that we give you good responses for those of you on the phone call. So we want to jump right in. I want you to know that we're joined tonight on the telephone by Dr. Anil Waithian. Dr. Waithian is the county's commissioner of the Department of Behavioral and Community Health. He is an infectious disease doctor, and we have used every ounce of his experience these last 60 days. Also with us is Commissioner Dana Smith, and Dana is the Commissioner of the Department of Emergency Response, and he's been leading our emergency response efforts, in particular purchasing PPE, etc. So what I want to do is encourage you, if you have a question, to please add that to the comments below the live feed on Facebook or dial 0 on your phone. I'm going to ask somebody here. I didn't put the hand sanitizer on my table, and I don't want to set the bad example, so I'm going to make sure that's added. I apologize. We're usually a little more, look at that, like magic, see? But I want to be sure we have it. So I want to jump in a minute. We are calling thousands of residents across Dutchess County. And you're joining us tonight on what is our weekly Facebook town hall meeting on Wednesdays. Every other Wednesday we have a telephone town hall as well. And as I said, we'll be live on Fridays as well. So Facebook is Wednesday and Friday, telephone town hall every other Wednesday. And we try to get you caught up to date on a response to COVID-19 and this pandemic. If you have a question, simply write it in the comment stream below the live stream, or dial 0 on your phone, and we'll get you into a queue to ask some questions. So we're going to get started, try to get through some details with you. And I want to remind you, if you have questions that don't get answered tonight, or you are looking for more information, you can visit us at dutchessny.gov. You'll see a series of tabs that you can click for specific information that's available at the county's website. And of course, you can always reach out to us at our COVID-19 hotline at 845-486-3555. Okay, so what I want to do is talk to you a little bit about what you probably have heard from the governor these last several days as it relates to the metrics and the benchmarks used to restart our community, reopen community activity. We have a couple slides that I want to try to get through. So as we'll jump back to that one in a minute. Oh, no, this is it. Okay, so I apologize. So these are the metrics that the governor's outlined. And what I want to say up front is that the governor has suggested that there's variance within these benchmarks, but these are not perfect. And what I mean by that is that there is no perfect measurement as to how we prevent or address in these data points the spread of the disease. What we do know is that the whole point of flattening the curve, staying home, social distancing, physical distancing, face coverings, was meant to slow the rate of growth slow the rate of transmission so that hospitals would not be overwhelmed. To that end, Dutchess County achieved that. We have access to some 500 beds in Dutchess. That doesn't include the additional beds that we were prepared to open. We were at, I think our peak was something in the neighborhood of 125 COVID-related patients in a hospital bed out of some 500. We are now down to in the mid-50s. And so we were able to slow the rate and not overwhelm the hospital system. But here are the indicators in order to begin this effort to restart community activity and to reopen the economy based on the state's benchmark. So this is the governor's and the state's metric. Decline in total hospitalizations, decline in deaths, and I'm sorry to have to talk about that. And I want to go back to those two bullet points because as we get to them, and why don't we jump to the dashboard and I'll read right off of this because I want to get back to those two and explain. We have the metrics used, the state dashboard metrics. We have that one. Let's go to that one. Again, decline in total hospitalizations, decline in deaths, fewer new hospitalizations, maintain hospital bed capacity, maintain ICU bed capacity, availability of diagnostic testing, and finally, staff contact tracing. So you'll see this available on our website soon. But if you visit the state's websites, you can see this basic information. And so Dutchess County is identified in the Mid-Hudson region. I will say that we have consistently asked that we not be weighed down by Westchester and Rockland. The state has not accepted that as a request. However, we know that within every region there is going to be variance. So we have been assured that even though we exist in this region, that there is some variation, that there are certain things that, frankly, would have to be restricted in places like Westchester, New York City, that clearly would not be necessary here, and we're obviously trying to work our way through that. But when you look at the 7 indicators, the 7 benchmarks, the region itself meets 5 of those 7, and that's important. 5 of those 7 we meet, and we'll talk a little bit about that. Now, the 2 that we currently do not meet that are problematic are the ones that I started with, the 14-day decline in hospital deaths and the new hospitalizations, under 2 per 100,000, and it's a rolling average. So you can see in the case of the new hospitalizations we have to be under that too, and so we're very, very close. And we would argue that as we move into next week, even if we're at around that number, that's satisfactory to meeting the benchmark. The other one though is 14-day decline in hospital deaths, or fewer deaths than 5. Now, I apologize that we have to talk about this because it is obviously sensitive. And in some ways, it's not obviously an issue that we want to have to talk in depth about. But that's hard to achieve because it's a lagging indicator. So, for instance, you may not see any increase in hospitalizations, and you may see a continued increase in testing, and the total bed capacity is still available. But you could see, because of the time that people suffer through the disease, I know this personally, that deaths become sort of a lagging indicator. It also is not an indication of the impact to the hospital system. Sadly, as you know, my father died because of this disease in a hospital. He didn't die because the hospital didn't have the capacity to save him, and he didn't die because the nurses or the doctors didn't care about him, and he didn't die because there were too many people in the hospital. He died because the disease took him. And so what we'd offer is that particular indicator needs to be looked at because it isn't something that suggests the inability to respond. The bigger indicators, and the ones that we are most concerned about, and the state has identified, and rightfully so, is hospital capacity. That we have access to the ICU and the hospital beds necessary should you see an incline or an increase in cases. So I'm offering all of this because the governor has established these benchmarks, and as of today, the region does not meet more than 5 of them. And if you use, in particular, the deaths, the hospitalized deaths, as an indicator, it becomes increasingly more difficult to achieve that if you continue to see individuals obviously test positive and then enter the hospital. But even if there's no impact to hospitalization or bed capacity or the capacity of the hospital system to serve, meaning no new cases, you could end up in a situation where, frankly, you're always restarting the clock. And I offer this because we are now surrounded by regions that are beginning the process. So the capital region is very likely to have met those indicators before we do. As you likely know, Connecticut has identified their phases of reopening. New Jersey has identified their phases of reopening. Massachusetts as well. So we're surrounded by regions where there's going to be economic activity. And so we've got to be respectful of that. So I only offer that in that we are being very, very careful and very cautious and very deliberate. The governor has established these regional control rooms, if you will, where we together, the county executives and leaders from these regions, talk through issues, ask questions. I will tell you that we're asking a lot of questions, and there are yet to be a lot of answers. And that's not a reflection of anyone not doing their job. It's that sometimes some of the questions there's no answers for. But we do need, as the governor it sort of widens the window and allows activities to restart, we need the data and we need the information. So we are also asking that the state include, and we've been told that this will happen on the dashboard that speaks to these data points, that they will also include county by county numbers so that you can see how we are compared to others. So let me say up front, even without Rockland and Westchester, Dutchess County does not meet those two indicators. The issue of deaths and the new hospitalization rate. But again, that doesn't mean that we've seen a growth in hospitalizations of any great number. It just means we never peaked and therefore aren't seeing the kind of decline that the indicator would want. So there has to be some variance within that. And we're going to continue to push there, and I'll be happy to answer questions as they come along. So let me also say, let's go to nursing home update. I want to talk briefly, and then we're going to go right to questions. As you know, several weeks ago, Dutchess County began testing patients, residents of nursing homes, working together with their nursing home facilities. And I want to say that, we have the utmost concern and compassion for families who don't have the ability to access their loved ones, and yet we are very grateful to the caregivers in our nursing homes who are doing wonderful work trying to connect families. And we have seen consistent a response to concerns, and our work groups have been working with nursing homes regularly. So we have been able to collaborate and stay in contact with them. I offer to you that that we began testing last week at all nursing homes. Ulster and Dutchess, along with counties like Onondaga, where Syracuse is, and some others, initiated nursing home testing. And then, of course, the governor, subsequent to that, announced that the state would begin testing or requiring testing of nursing home staff twice a week. So our nursing home task force, led by Mario Gonzalez and Ann Saylor, have been working with those nursing homes. We're thankful the state has made available to us 3,600 test kits so that we can conduct the tests necessary. We are testing residents of every nursing home. I want you to know that we have concluded testing at Wingate at Beacon and the Pines at Poughkeepsie. Every resident tested. Of the 104 residents at Wingate and Beacon tested, 13 new positive cases were identified of 104. Of the 157 at the Pines in Poughkeepsie, 6 new cases were identified, and the majority of these 19 were asymptomatic. They didn't show any signs of the disease, and therefore, we've identified them through that testing. We are working with the administration of those nursing homes to complete the testing. It'll take several weeks because of access or limited access to the laboratories, but we're continuing to do that. As you know, the state of New York reversed its mandate that nursing home facilities accept COVID-positive patients from outside of their facilities, and the governor has now mandated that staff be tested twice a week. We're still awaiting guidance from the New York State Department of Health on that, and we're currently working with nursing homes in order to obtain enough tests for staff. We're going to go to Mary Ellen on the call. Mary Ellen is from Pleasant Valley. We're going to take a few questions both from the phone and Facebook. Mary Ellen, question on contact tracing. Go ahead.
Yeah, I was wondering if we're going to be doing that up here and exactly what that is.
Yeah, it's a good question. The short answer to the first part is yes. We have been doing contact tracing since the beginning of this crisis. So when somebody tests positive, you would, as you may have, as one would have already experienced, you get a phone call from somebody at the Department of Health who asks you questions about how you may have contracted the disease and who you may have come into contact with. This isn't an effort to find out about, their living conditions. This is an effort to see if you, as a positive case, may have come into close enough proximity that you could transmit the disease to someone else. And so we then identify those people and tell them that you may have come into contact. And the reason that this is important is because we can identify very rapidly, and that's the goal, to have a rapid response, to identify where the disease is going for there. So you don't have a massive outbreak, you don't have a hot spot developing. And so Dutchess County, Anil, I know you're on the call. Dutchess County has currently how many teams working on contact tracing?
Mark, we have 8 teams that are rotating time on and off in terms of contact tracing. At least 2 teams are on daily.
So those individuals are following up on those cases. The state of New York is also hiring contact tracers. There is employment opportunity if anyone out there is interested. And the state is going to supplement our efforts on contact tracing. So that's the effort, and the goal is as we start to reactivate activities. Anil, why don't you explain to people that it is likely that we see positive cases, right? So as we reopen the doors, what are we looking for, and we're in essence preparing to prevent, and what should they expect?
That's a great question, Mark. I think it should be said currently. Just because the indicators show that the curve is flattening and going down does not mean there's no transmission occurring in the community. What should be understood is transmission will continue, but it's not driving the metrics that you mentioned in terms of hospitalization, deaths, and those individuals that could overwhelm the hospital in an acute care setting. Yeah. So what we're trying to do is buy enough time that activities can resume and that, the medical system can arrive at an effective vaccine or other treatments. So indeed, transmission may occur, but it's at a pace where our hospital system and our other systems have the capacity to deal with them.
And I know, thank you, Anil, and obviously we kind of monitor and look to respond to people on social media, what have you. And a lot of folks will say, we can't reopen, we're still seeing positive cases. We are going to continue to see positive cases, and interestingly, none of the benchmarks is the growth in positive cases. It's the growth in potential growth in hospitalizations, severity of those cases, deaths, and capacity within the healthcare system. Is that basically right, Anil?
That's a very good explanation.
And so people should be concerned that the disease continues to be transmitted, but it isn't one of the worrisome indicators. It's if those cases convert into hospital care. Is that about right?
That's correct. And people should understand, just because we're resuming some activities, our mitigation steps continue. The social distancing, hand hygiene, respiratory hygiene, and the use of masks and PPEs will continue.
Fair enough. So there are a number of questions on Facebook. Malia, Deb, and a few others asking about the region. So I'll return again. I will tell you that we did ask that Westchester and Rockland be considered separate and apart from the Mid-Hudson region. That has not happened. The governor and the state is considering us a region. There are a lot of reasons why that's factual and makes sense, and that there's interaction between the counties, and we certainly want to be cognizant and aware that happens. But also, we would argue that Rockland and Westchester in particular had a different experience with the disease, and even with that potential transmission, the impact in those counties south is noticeably different than we north. All of that said, what is important, and there are a number of questions, and I want to get to more phone calls. Arlene had asked, and a couple others asked about the differences between phases and phase 1 and phase 2. I mean, keep in mind, this is all sort of new, right? There's these benchmarks that we're measuring against, the state has sort of identified, and then there's these phases, low-risk businesses to higher low risk activity to higher risk activity, and the risk level being the ability to transmit the disease. So, even without Westchester and Rockland, the Hudson Valley region still falls short on at least one of those two remaining indicators. And again, we're not trying to find a way around it. The hospitalization number, we're at about 2.3 when we need to be at 2. My assumption is that we will get very close in the next several days to that 2, and some regions will end up opening at that number, 1.92. So we're hopeful, and the governor said there'd be some latitude there. But on the death indicator, and again, I wish we weren't talking about this, but that death indicator is not a useful indicator because it doesn't suggest anything about the hospital care or the capacity to care. It suggests and talks about the devastation of the disease to an individual. So I would offer you, even without Westchester and Rockland, we're not currently achieving all 7. That said, what the governor, I'll admit out loud, it was a little confusing this week, and I'm hopeful that this gets some clarity. Originally, we were told once you hit the first benchmark, that it's every 2 weeks you can then enter the next phase. The governor yesterday at a press conference said, well, maybe it won't be as long as 2 weeks. Now, we're open to whatever is that philosophy because we think that the goal here is to be safe and deliberate. But we need, obviously, that to be clear. So the questions about the phases, that's what we've been advised. Every 2 weeks, a new phase, assuming the benchmarks have been hit. Leonard in Hopewell. Why don't you go ahead? I know you have a question regarding wearing masks. Leonard, are you there?
Hello?
Go ahead, Leonard.
Hello?
Go ahead, Leonard. Can you hear us?
Yes. I was on the rail trail today, and it was crowded. There were very few masks being worn, and very little attention to social distancing.
Well,
there's no signage giving advice as to what the proper protocols are. And to be quite frank, I was concerned because with the nicer weather, that place is going to be packed.
Yes, well, you're right, and it's good to be concerned, and thanks for asking. First, we've been putting up signs at every one of the county parks, in particular the rail trails, and admittedly, people keep taking them down. In fact, I just saw a new version of the sign that's going to go back up. So if you're watching, please don't take down our signs. That's good information for people, and certainly Leonard's right to bring it up. Secondly, we want to remind you, and we're going to continue to remind folks, that if you're out in a park or a setting like the rail trail, keep it small. We want you to travel in small groups, so to speak, to the extent you can remain in a household. And if you can't, then you should have a face covering. And that face covering you should wear if you're not able to socially distance. And we know with the good weather, and believe me, I know with my family, we want to be out and about. The goal is to be considerate of one another. So we're encouraging you, and we'll continue to encourage social distancing, even out, while you're out. Try to keep it small, meaning, obviously try, if you can, stick to your own, sort of household. You can meet up with other folks, but if you do, social distance. And if you can't, engage in that social distancing, you need to wear a face covering, and that's our guidance to you. So there will be new signs installed. I think we install them regularly, and as they come down, we replace them. And you'll see that at county parks and other local parks as well. If you have a question, dial 0 on your phone. We're going to go to Jack. Jack's on. I'm going to try to get through as many phone call questions as we can tonight with some others. Jack, go ahead. You have a question regarding gyms, I think.
Yes, I was just wondering what days the gyms and office buildings and things like that would be opening.
Do we have the phases? Let me pull up the slide, and I'll answer your question as we do that. This is not good enough. I want to say this out loud. This is what the state's provided us. This is not adequate. The lists are not finalized. They need to be. I think we're at a point now where the public needs specifics and expectations, and this isn't there yet. But phase 1, as you can tell, is the construction, wholesale trade, manufacturing, curbside, retail. And I will tell you, as of today, Dutchess County, again, doesn't meet the state metrics, but there is construction underway that's deemed essential. And I apologize, that's right. I'm reading a chart that you can't see. I forget you're on the phone. So phase 1 is those businesses. Phase 2 are professional services, finance and insurance, retail, administrative, and real estate, office space. So if you ask me about offices, that would be sort of phase 2. Phase 3 is restaurant and food service, and that's dining service, that's sit down, presumably less capacity. And phase 4 would be gyms, arts, education, and what have you. So in theory, gyms are phase 4. I can tell you that I'd like to get to a gym. Gyms are phase 4, and based on what we know, that would be a total of, at this point, as many as 6 weeks from now. But the governor, again, yesterday said maybe it's not as long as 2 weeks. So we need that clarity, but that's the direction as of today. I know there are a lot of questions regarding salons, hairdressers, and barber shops. The state has not advised which phase those businesses fall in. We think that they would likely fall in the phase 3 category, but the state has not said that. And I'd offer that that's something that we're asking for clarity. And I will tell you, why don't we pull up our pledge, because I think it's something that everybody needs to adhere to. We are really trying to be very, very clear about what we share and how we share it. So what we're saying from us is you should expect that we're going to work together with our neighbors. You should expect that we are exceptionally clear with what we know. We need to be honest about the risks. And we need to be specific about plans. And I just think at this point we need that specificity from the state so that you know what to expect and we can communicate it. But every Wednesday and Friday, I'm going to update you as best I can. Try to get through as many of these as I can. What about campgrounds? Terry asked us about campgrounds. If you're talking about RV and tent camping, Dutchess County is moving ahead. In fact, today, we sent guidance out to applicants for those kinds of camps to apply for their permits and to develop with us those protection plans. And assuming that they meet the expectation, we are prepared to permit campgrounds and RV camps for the end of this month, meaning around the last week of May, or the Memorial Day weekend is basically what we're comfortable with if they meet those expectations. If you're talking about private summer camps, we're pushing that toward meaning overnight camps, what have you. Same basic expectations. Fill out the documentation. Provide us your guidance. Provide us what it is for your safety plans. We expect that we could permit those to occur in the July 1st timetable. I apologize, Anil, for driving for forgetting that you're on the call, but that's about what we're giving on campsites. Is that right? What should campers or campsites be aware of as they develop their proposals to us?
That sounds about right.
Well, that was a short answer. So that's the game plan. A lot of questions about churches. I want to say to you out loud that on a regional call today, we were advised that there is no guidance on when congregation settings can begin, meaning in churches. I would suspect that that's more of the phase 3 category. But I will tell you that we were told that there is no objection to vehicle services in church parking lots. So I am saying to you that Dutchess County, as apparently some other counties, are now comfortable with. The state is not directed that is not a problem, and therefore, at the very least, parking lot service or parking lot church services or religious services are not restricted in Dutchess, and we're waiting for guidance because on Friday, May 15th, drive-in movie theaters will be able to be open with some restrictions, and we certainly believe that if it's okay to have a church service in a parking lot, it would be okay to have a church service in a drive-in theater. So those are the directions and basically the guidance that we've gotten from our regional call. But congregation gatherings, and I'm a churchgoer myself, we at this point haven't been told by the state what phase they feel that's in. We're assuming phase 3 with certain restrictions. Delora is asking about food, access to food and other support. If you have a question and you need help accessing food, meals, or transportation, visit dutchessny.gov. You can go to Dutchess Responds. You can also call us at 845-486-3555. 845-486-3555 is our phone number for Dutchess Responds, and that's a service that we're happy to provide you. I want to remind you, if for some reason you might get disconnected from the call, please dial 845-765-7121, 845-765-7121. If you have a question, dial 0. We're going to go to Chris. Chris has a question regarding construction. Chris, go right ahead.
Yes, hi, Mark. Thanks so much. Just wanted to know if you have plans to reopen construction next week.
That's a good question. I have all the plans in the world, but the truth is that these benchmarks and these phases are determined by the state. The governor has issued those orders. So what I would tell you is that we do need the governor to begin lifting those restrictions. Assuming we are close to those 7 benchmarks, those metrics that I mentioned, construction is one of the industries that could begin next week. I will tell you that we are not on track to meet those numbers prior to this weekend. We are hopeful that with a little bit of variance, we can get in all 7 of those metrics, those benchmarks, early next week, within the expectation that phase 1 would begin. I will tell you, as of today, based on the hospitalizations and the numbers that we've seen and the decline in hospitalization, that and the fact, by the way, that there is construction underway. Please understand that there are projects that have been deemed essential. Everything from salt sheds being built by the state highway departments to educational facilities being built. In fact, Dutchess County can continue to build our hangar at the airport. So construction is underway, and my point of saying that is that we do not believe the next phase of simply allowing certain commercial or residential kind of construction to occur is going to threaten public health, but we're waiting for the state to provide us that authority to proceed. I'm going to Anil, is that right, on the telephone? Not Dr. Wythe and Anil. Anil, who called in, had a question regarding elective surgeries.
Yes.
Is it Anil?
Yeah, my question was that can ASCs commence elective surgeries?
We believe that, the governor today was asked and doesn't yet have a directive. So elective surgeries not in an ambulatory center setting are permitted in Dutchess County. Orange County was just added to the list today. We've asked for ambulatory centers and doctors' offices to be able to provide necessary, and again, I wouldn't call these elective. They're necessary or not. And we believe that it is safe to proceed. We've asked the state to give us that authority, and incrementally they've allowed that in other counties. We have asked the regional group now 3 times, and we're hopeful that this week we have an answer from the governor's office. But our position is that ambulatory centers should be allowed to proceed with necessary surgeries. I mean, like cataracts and things of that nature are not sort of selective, and certainly they can be conducted safely, especially now that the state has permitted the same kind of activities to occur in a hospital setting. Okay? So hopefully in the next day or 2 we will have an answer. Dawn asked about unemployment, trying for 7 weeks. You are not alone. First, keep in mind that the benefit for unemployment goes back to the date of severance. So even though it's taking a significant amount of time, you are to be paid from the time that you were let go, downsized, surplused, fired, not fired, but severed from the employment. But the system is overwhelmed. This is a New York State unemployment system. We have advised that that perhaps doing this online and not requiring the follow-up phone calls would be the best approach. However, this is still the system that the state is using. We will try to help if we can individual cases, but we actively advocate for you to get the help and the support that you need. If you have a question, dial 0 on the phone. We're going to go to Darlene. Darlene had a question about churches, about Rockland, about Westchester. Go ahead. You can get both of them in.
Hi, yeah, thank you for taking my call. I was just wondering, why is Governor Cuomo associating us with, because we're our own entity, with Rockland and Westchester?
It's a good, yeah, go ahead. You want to answer your second question too?
Yeah, yes, thank you.
So Your second question was about churches and church activities as well. We have the map. I know that you can't see it, but so I'll answer it. I mean, first and foremost, we are in a region with Westchester and Rockland. There isn't. We actually live in that region. In particular, in Orange and Putnam, you can live in those communities and work in New York City for New York City, but also a good number of our residents work in Westchester South. And by the way, we actually have, as a county, one of the highest in-county commuting, so meaning that there are people from outside Dutchess who commute into Dutchess County to work. So there is that natural connection, and of course Metro North and the connection via the rail system puts us in a greater proximity and ease of access to the city. We agree that from a very basic, understanding of the region, we're sort of in this together. However, we think that Westchester and Rockland, because of their experience with the disease, is different, and beyond that, they are different. Their population density is different. The ease of access is different. We are much more rural and suburban, and therefore you can see that play out in our actual data. So the state is keeping us in this region, but I do know that they're giving us some latitude within the region because the numbers vary from county to county. It's also interesting, and this I'm really going far afield, but the Hudson Valley is a strange region because it's linear, meaning it's from the southern tip of Manhattan all the way up, well, frankly, to Malone, New York, but certainly to the Capital District, and we don't have that same compactness that other regions of the state have. So you can go to where I live in Red Hook, right, and we do our agricultural shopping in Red Hook and Columbia County. Our shopping centers for Northern Dutchess are basically Ulster County. Many don't come to Poughkeepsie to shop. They'll go to town Ulster. So from our perspective, we want to be considered certainly in the region, but we don't want to be weighed down by the density of population that exists in the county south of us. But I'll stop again and say that if you use the governor's benchmarks and the metrics, even without Westchester and Rockland, we don't meet them. And we're on track to meet them, except we believe that one or two are going to be elusive because they're not the most appropriate ways to measure the severity of the disease and the challenge to our healthcare system. And I know you asked about church services again. We believe that church services are in that phase 3 area. But again, I'm telling you today that if you attend a church or a synagogue or you have some religious institution you're involved with, having a vehicle service or a vehicle service in a parking lot at the church is not something that is prohibited, and that was made clear to us finally today. Mark is asking online if there's any children in Dutchess with pediatric multi-system inflammatory syndrome. Dr. Wythian, I have bullets on a sheet of paper in front of me that I could read, but rather than do that, since you are the Commissioner of Health, do you want to talk, or could you talk a little bit about what this pediatric multi-system inflammatory syndrome is, what we think its relationship to COVID is, and what we've seen in Dutchess?
Sure. Children, it's been known that children who have viral illness, post-viral illness, their immune system can go a little haywire, and they could sort of have an inflammatory reaction. And there is a disease state called Kawasaki's disease, where children may have swelling of the extremities, red eyes, cracking of the lips, or have toxic shock-related type symptomatology. Well, we've known recently that post-COVID infection in young individuals, they may present with this inflammatory type of manifestation. And this has come to light. I could say currently we have not heard of any cases within Dutchess County, although we have a number of cases of identified COVID disease in individuals less than 21 years of age. But we don't have any individual identified so far with this symptomatology and syndrome. But the state has made it a requirement that physicians, if they identify it, should contact their local health department. So we are monitoring for this.
Terrific. Thank you for that update. And I know it's a question and a concern that many people have. Cindy asked online, and I know that this is an ongoing topic, and Anil, maybe you could help us address it. And that is, how do we know that the deaths that have been identified are in fact COVID? Who does the investigations ultimately? And I'll use this as an example. There's online. There's a push that somebody put out there that said, an individual died in a car crash, but happened to be positive, and so they listed it as a COVID positive death. That is not something that we've experienced in Dutchess County. I don't know I don't know. It seems like one of those online memes or whatever you call them. But is that right? Do you want to talk a little bit about that? How do we know that these are COVID related, and who ultimately does the investigations?
Sure, that's a great question, Mark. I don't know where this information is coming from, but let me explain the three settings where people typically, physicians have to declare the cause of death. There's the hospital setting where physicians have to report on the cause of death. And typically, I've been in those settings, and what physicians typically list is the immediate cause of death. And rarely is COVID or any infection the immediate cause of death. It can be, but usually the immediate cause of death are causes like cardiac arrest or respiratory arrest. Now, you could also list contributing causes. Contributing causes can be things like sepsis and other infections where COVID can come into play. The other setting where causes of death can be reported by physicians include our medical examiner's office. In our medical examiner's office, when a cause of death is identified, usually it's a very rigorous process, meaning an autopsy was done, lab tests for serology, for immunology, and as well as toxicology is done. So once a medical examiner certifies a cause of death, I'm very confident in the result. The last possibility is deaths that occur in the community. Usually the deaths that occur in the community are sort of certified by physicians, but unfortunately there's not a lot of information readily available to that physician. They may not have the results of tests and so on and so forth. So again, I cannot speak for how valid those test results may sort of have an impact on the certification, but it's well known in terms of epidemiology and vital statistics that usually the numbers that are reported due to infectious causes tends to be underreported because we tend to rely on the availability of testing and the application of testing by physicians at the appropriate moment. So I think I'll stop there.
That's a good one. I wanted to give you some extra time to get through it, so I appreciate that. That's a great answer to an important question. Kathy is online. Kathy has some questions regarding testing at our nursing homes. Kathy, you want to go ahead?
Yes, thank you for my call. There are so many nursing homes in the area, and you listed 2 that have been tested already.
Yes.
I was wondering how they get tested. Is it a team that goes in and tests them, or do test kits go to the site for them to self-test each facility?
It's a little bit of both. So first, we have Dr. 12 or 13 nursing homes in Dutchess County. We have a schedule that that began last week, and we completed those 2 with results in. We then have several that are underway now, and each week we'll accomplish a few more. This will take us till the last week of May. A lot of that has more to do with the labs and access to the labs than it does access to the nursing home. Dr. Wythian, how we monitor the tests, but we don't administer the tests. Is that correct?
So we have been coordinating with the nursing homes to enable testing of their patients and residents. And so part of it is Some nursing homes have the staffing and the trained personnel to conduct the test. If we find that a particular facility does not have that capability, we could assist with training. Now, what we have done is at this time, we have more than enough test kits. But Mark, you brought up the point that is critical. The rate limiter for testing of nursing home is the capacity of labs to actually conduct the test once the samples are sent to them. And so right now the bottleneck is with lab capacity.
Okay, and so we're coordinating with them. We're working with them. We monitor and sort of provide direction on the testing, keeping in mind that counties don't have any jurisdiction over nursing homes. So they're participating in a voluntary way, and we're getting the tests complete. We were I don't want to say happy, but we were definitely not alarmed by the results that we've seen so far. But we've identified that there are certain people who potentially with no symptoms did test positive, and therefore their institutions, their homes, their organizations will respond to those patients, and we'll continue to update you as those numbers become available and the tests are completed. If you have a question, dial 0. Let me see if I can get through as many of these online. If you have a question also and you're on Facebook, type in the comment area below the live stream, and we'll get started. Tiffany asks, what happens when we reach 7, all 7 of the benchmarks, and we reopen or start to reopen, and suddenly hospitalizations spike? Well, the governor has described this as sort of tightening and loosening of a valve. So as we open and gradually open, and understand, I really want this to be clear. There's no expectation that we just go back to normal next week. This is very incremental for a reason, and that's to slow the transmission. Transmission of the disease is going to happen. People are going to catch or contract the disease. We know that. The issue here is keeping the demand on hospitalizations low. And so when the question is asked, what about a spike? We're hopeful that through incremental return to normal or new normal, we won't see a spike. But if there is a spike, you would tighten the valve and slow down and perhaps retract a bit. And that's all a part of this sort of ongoing effort to monitor cases. But the expectation is that we incrementally restart activity and incrementally and by doing that incrementally, keep cases low. Fifi asked, when do you foresee larger weddings taking place? Not certainly before too late, not too early this summer, I can tell you that. We're functioning with the belief that sometime in the month of July, you could see larger gatherings occur. And certainly in the hospitality world, we'd like to accommodate that, and again, with certain precautions, that could happen in the July timetable, but certainly not before. And those are actually the things that we worry most about, right? So, Anil, it's not so much, and maybe you want to address this too, obviously there's concern about the controlled environment, like an office setting or what have you, but we have, it's easier means to control those kinds of settings than, let's say, a large wedding or a concert. And those are the kinds of activities that pose the greatest risk, no?
Mark, I totally agree, because, again, the individuals who may come to those events are not restricted by one particular community or jurisdiction and may cross states and other counties. And so the impact is felt much more widespread.
Thank you for that. Mark asked online, do you still need a prescription to get a test at the Dutchess site? Some that you do and some that you don't. Dutchess Stadium, you still do need to get a prescription. There's a process. Visit dutchessny.gov. We'll give you that process in order to access that testing site. A prescription is not necessary to Mid-Hudson Regional, but there's a process to access the testing that results in you getting accessed. There's a drive-up test site at Pulse MD and Rite Aid in the city of Poughkeepsie. And in that situation, you have to pre-register and bring an ID, correct, Anil? Or do you remember the Rite Aid is pre-register and you get an ID and bring your ID?
I believe so, but they don't require a script.
No prescription. And then there are some physicians that have access to testing, and you can always contact your doctor if you have one for that. Meredith is asking, when will DMVs open? If only we knew, Meredith. The state of New York hasn't built out the list, and therefore, excuse me, apologize. And therefore, we don't know. The state has not said what category DMVs fall in. A DMV is actually a state agency, administered in this case by County Clerk Brad Kendall. But nevertheless, I get $5 every time I say Brad Kendall. So Brad Kendall owes me $15. Sorry. But that said, we have not been given direction yet as to when the state believes those DMVs will begin the process of opening. But understand, when we do, it is unlikely that all of the satellite offices that we administer would be open, and it would be somewhat centralized and somewhat restricted as far as general access. Heather is asking about high school graduations. I would love nothing more than the high school senior to enjoy a traditional graduation. We don't foresee a normal, ordinary graduation activity occurring. However, I want to say out loud, the state has said, and I'll say this again, church services, religious services can happen in a car and a church parking lot. Drive-in movie theaters can be open. Obviously, you're in a car in their facility. We think that it's entirely appropriate with those restrictions for a high school graduation to occur in a vehicle kind of way. So I wouldn't expect your front, in my district, the Linden Avenue Middle School is a beautiful old traditional school building. You have the graduation out in the front yard. I would not expect that occurs certainly in the month of June this year, but some sort of alternative that includes vehicles and people staying in their cars is certainly, we think, possible and logical if those other activities are permitted, drive-ins and church activities in cars. William asked about the Renegades. In part, the Renegades playing has a lot more to do with whether or not Major League Baseball is permitted, if Major League Baseball has an option, and then Minor League Baseball could. We would foresee that would not occur in the month of June, certainly. The Renegades, as part of minor league baseball, have a very extensive and quite impressive safety plan that they've put together. But again, that would be in the context of those phases, and they would clearly be in phase 4, which would push you into the July timetable. And I would offer to you that perhaps a limited season with limited capacity would be possible, but keep in mind that baseball teams like the Renegades play teams that come from Brooklyn and Staten Island and other locations that you may not want to have that kind of interstate travel, or intra and interstate travel. So we're hopeful that some version of minor league baseball can occur this year. I will tell you, as the landlord, the county is the landlord of Dutchess Stadium, we obviously want folks to enjoy themselves. We also have a financial a burden if the Renegades aren't playing baseball. They're not bringing any resources, and thus we're not able to get the revenue that we project from that partnership. So Sherry is saying she lives in Dutchess, works in Putnam. Will both counties be open together? Yes, Dutchess, Putnam. At this point, Dutchess, Putnam, Ulster, Orange, Westchester, Rockland, Sullivan counties are all in one region and would incrementally begin the process of opening together. We're going to go to Mrs. LaCorey, who's online. Mrs. LaCorey.
Yes, thank you.
Go ahead.
Would like to know, we are in Florida and we are flying home to Albany in June. Would like to know if when we get home, do we have to self-isolate?
Well, first, the question is, why are you coming home from Florida? Is it just family? Because, they may be okay if you want to stay in the sun a few extra days.
No, because we just would like to get home and all our flights were canceled.
If you want to come home, that's a good point. Dr. Wythian, why don't you answer Mrs. LaCorey's question? So she's flying in from Florida, and others may be asking the same question. What happens when she comes home? Is she mandated to quarantine, or should she just take the precaution and stay in for those 2 weeks?
So, I think the latter would apply because, again, the whole point of self-isolating coming from a different location would sort of indicate that, again, there's community transmission in one particular place and not another. So there's transmission in Florida, there's transmission here in New York. I think the important thing is once you arrive from Florida is to take the precautions in terms of social distancing, the respiratory and hand hygiene, and to not put yourself in a position where you could potentially be exposed.
Thank you for that. So we would encourage we would encourage you to take the step of voluntarily, in essence, isolating. But even that is not lock yourself in your house, but limit that interaction and try to stay on your residence for that period of time. That's the advice, but not the mandate. Maureen asked about which phase courts reopen. Courts are going to continue to function virtually for a period of time. We don't expect them to reopen formally until well into June is the direction that we've been given from the states and the courts are, even the county court is a state court just operating at the county level, and therefore they'll set that particular standard. But I would not expect courts to reopen in any fashion until well into the month of June. Dora asked about county buses running more routes. We expect that as our bus routes will function and expand as the reopening expands. So phase one would likely include certain modest increases in routes. So if we hit that phase, we would want to be able to transport people to and from employers, manufacturers, obviously being open. May require us to expand phase two more and phase three even more. So you could see the county's transit system grow back to its traditional routes over those four phases with incremental increases. And again, that's out of precaution for the drivers, safety for the riders, and the recognition that we need to help people get to and from their jobs and work. We did get a question earlier about nursing homes, and I forgot to mention that we are providing those nursing homes as part of the testing, access to personal protection equipment, which reminds me that Commissioner Dana Smith is on the call. And the Department of Emergency Response is doing a great amount of work moving PPE to providers. Dana, do you want to talk a little bit about what we've been doing and what we expect moving forward, in particular as we reopen? What's the role of the county and what do you expect? I mean, I know these answers, but what do you expect for the public's understanding will be the role to assist businesses and other frontline responders?
Absolutely, sir. With your support and direction, we've been, as you related earlier, working with the nursing homes and assisted living facilities. You established that task force that is working with them. They have direct relationships with our supply unit that is providing PPE to all the nursing homes in the county and the assisted living facilities and many other groups as well. As you know, there's over 175 different entities we're providing PPE. Additionally, working with Assistant County Executive Ron Hicks and the Chamber of Commerce, we were able to secure through FEMA and Health and Human Services fabric face coverings. And working through the Chamber, they have a program through the Dutchess Business Network where businesses can register to attain these fabric face masks. And we continually to seek out more sources of those so we can assist businesses with those face coverings as they reopen.
Thank you for that. We appreciate that explanation, Dana, very much. I want to get to Denise. Denise had a question. She's on the line regarding the economic impact to the county. Go ahead, Denise.
I'm just wondering what the economic impact has been to the county and people out of jobs, and what can we do to help these people?
Well, the federal government and the state government have to continue to assist. The counties don't have dollars or resources necessarily to provide direct aid. So first and foremost, Congress is considering now continued support. And that has to happen. We need that to continue. We need it to be easier for small businesses to access those services, and unemployment needs to continue as we reopen. But as far as the impact, first and foremost, we saw about the largest increase in unemployment of any county in the region, and I can't say that I can explain why we had a harder hit in unemployment than others. I think it has more to do with where people go to work. But that said, significant financial impact to families. We know that overwhelmingly our small business owners have said that they stand to lose as much as 50. I mean, certainly more, but as much as 50% of their annual activity has already been lost. And we know that families are seriously impacted and hurt, and we recognize that. So the county is trying to be of assistance. Our IDA, our Industrial Development Agency, at my request, is starting a loan program for small businesses that don't qualify for the federal aid. We want folks to be able to apply for that. That'll become more readily available. Also, we're working with the federal government to use some federal dollars that we've received to provide assistance to small businesses in particular, and also to provide assistance for families in need of child care as the economy starts to reopen. Now, as far as Dutchess County is concerned, I think this is probably a good moment to say financially, as far as the county is concerned, we went into this with the highest bond rating of any county in the state, a substantial rainy day fund, a fund balance. It's pouring, and we've used a good amount of it. And so what I would tell you is that the last two receipts of sales tax, and this is so sales tax represents about 40% of our revenue for Dutchess County. It's the largest single revenue stream. We received two payments. Our first 2 weeks of May. These are payments that are related to the timetable where this shutdown began. We saw a 24% reduction in sales tax receipts in the first payment and a 38% reduction in sales tax receipts in the second payment. If we continue at this pace, Dutchess County, and every county in the state is looking at this, but Dutchess County is looking at between a $40 and $60 million loss in revenue. That is substantial when you think that 70% of our budget is mandated. At the same time, we're bracing for whatever the state will provide us in cuts. And so the governor has said to prepare for an additional 20% reduction in state-related assistance for counties. And so I'll tell you that we really need you to join us. I know that there's this debate, and I'm going to say it right out front. There, based on politics, there are people who say, don't bail them out, and then there are people who say bail them out. First, I want to address this. No one's bailing anybody out. We are living in a situation where states all across this country made decisions that have impacted the finances of good, hardworking people, organizations and businesses, and governments like ours. At the same time, we county governments are responsible for responding. We're setting up the test sites. We're setting the tracers in action. We're monitoring the 911 dispatches. Our sheriff's deputies are out on the roads doing the work. I'm not asking anybody to bail us out. I'm just asking, and we are asking the federal government to provide the assistance necessary for us not to have to gut county government. And what that means is hundreds of jobs. Now, I would argue and say to you, certainly that the challenge that every ordinary New Yorker has that's without a paycheck is enormous, and how families are doing it it comes with a great deal of stress. We don't want to restart the economy only to have hundreds of government employees then laid off because we don't have the resources to pay them, and you don't want us not doing the services that we're to provide. At our level of government, we're very efficient, and more importantly, we do the work that the president and Congress and governors and mayors expect of us. That's what county governments do. We're responding. We're the public health entity. So we're asking for the assistance, not without any strings. We certainly expect accountability, but there needs to be that lifeline in order for us to continue to do the work. And my commitment is not to shift the cost to taxpayers, but we are confronted with an enormous challenge, unlike anything we've felt since, quite frankly, the Great Depression. And our goal is to minimize that impact. So that's where we are. Excuse me. We're going to get to a couple questions on the phone. If you have a question, dial 0. We'll get to that. Mark and Patty have asked online about voting. So to those questions, first, school district voting you should know about. School district budget votes are commencing. That will be entirely by absentee ballot. So you will be sent an absentee ballot in the mail happens to be in most cases printed by Dutchess County's print shop, but you'll be sent a ballot in the mail for your school budget vote. You will vote on that ballot only, and you will send it back into your respective school district. That is entirely by absentee ballot. The June primaries, which now does include a Democratic presidential primary and some local primaries, will be by absentee or in person. You will be mailed an absentee ballot application printed by Dutchess County's print shop. County government will print that absentee ballot application. If you get that application and you prefer to vote by absentee, you complete that ballot application, you send it in, you'll be subsequently sent a ballot. If you prefer not to vote by absentee, you can show up at a poll site. There will be fewer poll sites and there will be restrictions. So I prepare you that I am all for people waiting in socially distant lines if you wish. Obviously, we want to minimize large groups, but if you want to vote in person, you have that right. But do expect that it'll take a little bit longer, and you will likely not vote in your traditional poll site. In fact, our Board of Elections, led by Beth Soto, the Democratic Commissioner, and Eric Haight, the Republican Commissioner, have been working with towns, villages, and cities to identify those poll sites, and so they'll be made available to you. You'll know about them. Lastly, there is some confusion about the November election that the governor needs to clarify. The Democrat elections commissioners in Albany believe that the absentee ballot requirement by mail extends, you get the application, extends the November ballot. The Republican commissioners don't think the order says that, so the governor just needs to clarify. So as of today, school districts by mail entirely, you'll get a ballot in the mail. June primaries, you'll get an application to fill out, and then if you wish to vote absentee, you'll be sent a ballot after you complete that application. That is the same, by the way, for village elections, which will occur. And then the November election is still undetermined as to whether or not you will be provided an absentee ballot application or not, and that will be determined, I'm sure, and clarified soon. Diane asked, are we mandated to wear a mask? The instruction is you should wear a face covering. This is the governor's order. You should wear a face covering when you cannot socially distance. I will be candid, it is not an order that comes with a penalty, but it is the least selfless thing that we can do and to be considerate to our neighbors. So we are asking that you comply and that you use your better judgment and that you be considerate to your neighbors. Wearing a face covering can slow the transmission. Doctor, while I have you and we're talking about face coverings, I know that you had this conversation with me, and that was prior to a couple weeks ago, the CDC suggested face coverings were not all that effective. Now they say they are, but it's not that they weren't effective and they now are effective. It was simply a gradient, right? It's sort of, yes, it's helpful, but it doesn't replace social distancing. Do you want to talk about face coverings, or could you explain, why the change in position among, people in your line of work?
Mark, that's a great question. I think the one thing that people have to understand is, in the beginning, we didn't have this level of the population that's transmitting this virus. So now you have a lot more penetration of the population having this virus and also having this virus and being totally asymptomatic. So we know that simple speaking, singing, and coughing are some of the modes where people can transmit to people within the surrounding area. So wearing a face mask when we know that so many people in the community may have the virus and may have it asymptomatically is the prudent thing to do.
Thank you for that clarification. Elizabeth asked when malls are going to open, and I would offer to you that based on the governor's directive, malls would be sort of phase 3, we think, which is more congregate settings. But you would see the retail spaces be able to do curbside or open ahead of that. And I'd offer you that one of the things you want to be cognizant of, right, is that over these phases you'll see some incremental increases. And I will offer this out loud. I want everybody who has a job to be able to go back to their jobs, and I certainly do my own fair share of shopping in national chains. But I would also say to you that this, over the course of the next few weeks, is an opportunity for us to really show our support for local small businesses. They don't have the national supply chain, the national resources, the national lawyers to protect them, to defend them, to provide them support in order to comply with all of these regulations. So supporting your small business, in particular when we get to phase one, that will allow them to open for curbside or pre-ordered kind of settings. Please support them, and this is that opportunity to do it. You're likely to necessarily get there and have a crowd, but they're going to need that help. The other is, I would say, keep in mind that if there are folks who say, let's open up, some of these businesses can't afford to open without a large enough consumer base. So if people aren't going back to work and they're not getting access to the paychecks entirely, or they choose that they don't want to be out in a group setting, some of these businesses may choose not to open up as rapidly as you want them to. We should respect that too and show them our support, because ultimately they've got to make a decision as to when is the right time to reopen. You just don't open the doors because somebody's going to show up. You've got cost. You may decide to incrementally on your own make those decisions. But again, I'm encouraging folks to shop local, to shop small, and when you can, show your support for those small businesses. They represent 80% of our economy, and we know that most new jobs created are created by small businesses, and we want them to be successful. Denise asked about group homes for those with special needs. I will tell you, we continue to work with them, and in fact, I had a call today with direct care workers. You're the heroes, believe me. Yes, absolutely. Traditional heroes, nurses, doctors, emergency responders, law enforcement, public health nurses, and our direct care workers. You're doing wonderful work. We're continue to communicate with those facilities and those homes. I do want to say that today somebody suggested that the state was limiting individuals who live in group home residence settings from going out. We hope that isn't true, and we're going to make sure that it isn't. Certainly, a group who shares a residence could go out in the community, go to a park. We ask, obviously, to be cognizant and aware of trying not to, to absolutely engage in social distancing. And if a mask isn't possible because of some condition or some disability, well, then we just engage in that social distancing. We want people to do that. We're going to continue to work with them as well. Kathy has mentioned something, and then we'll go to Mary on the phone. So we have a few questions online. On the phone. Dial 0. We'll get you some answers. We have a few more minutes, and I think we're keeping up as best we can. Kathy asked a valuable question, or at least mentioned about the stress and anxiety that people have. And so let me pull up just a reminder. I'll say this, first of all, no politician should sit in front of you and say what you think or you feel is inappropriate. So there are folks who are angry and want everything just to go back to the way it was. Open up the doors, let us go back. And somebody probably saying, yeah, that's right. That emotion is perfectly acceptable, as is the emotion from somebody, and I represent both of you, who says, listen, too soon, I want to stay in this state for a little bit longer. The uncertainty, the fact that there are more questions than there are answers is entirely, your feeling about all of that is entirely appropriate. And so Dutchess County continues to operate our public health structure. So our mental health support system is there for you. The helpline, 845-485-9700 is our helpline. 24 hours a day, 7 days a week. And I'm telling you, you can call and just talk. It's perfectly okay. And professionals are there. No one's going to judge you. No one's going to diagnose you. If you have a particular concern, they'll be there to help you. And if that's what you want and need, we're here to do that. You can call, even text. Sometimes texting is more therapeutic. Do that. We're here to provide you that assistance. Our stabilization center is here for more specific cases of concern, drug addiction, mental health crisis. But there are providers there through telemedicine that can help you any moment of the day. And so we really encourage you to take advantage of those services, and it's okay to do that. And believe me, I can understand why it would be why you would want to make use of those services, and we want you to make use of those services, and it's very, very important. We want people to not obviously be overwhelmed, and I know it, right? My father-in-law owns a small business in Virginia. He's gone through some of the same difficult decisions. They've been on lockdown, I think, and closed until June, making the decision, having to lay people off, having not to be able to provide services. These are tough feelings and difficult decisions that come with a lot of stress. And no matter what side of the equation you're on, I can understand why people are stressed out. So there are people who need that support and services. We're going to go to Mary. Mary had a question. She tried to register for the MRC and couldn't. Mary, are you with us?
Yeah, I'm here. Can you hear me?
I can hear you loud and clear.
Okay, great. Well, first of all, I wanted to thank you for your very calm and efficient and very caring leadership through all of this.
Thank you for that.
You're welcome. And so, yeah, that was my question. I had followed the link that was provided in one of the Dutchess County emails, and I found myself traveling all over the web and to many sites, but could never actually register for Dutchess County.
Interesting. So first, I apologize for that. Joe Ryan, who runs our Medical Reserve Corps, is a saint. He not only because he's a Mets fan, but because he does a really good job. So my suggestion is, yes, I mean, well, anybody who's a Mets fan knows the torture of that. This is the best season the Mets have had in a long time, and they haven't started playing. That said, Joe can help. So what I'd suggest is, yes, going through that web-based system can be confusing and may send you in different locations. So visit dutchessny.gov, and you can sign up for the MRC or not. I would sign up not on the MRC, and we can direct you how to do that, or call the help hotline and say, I was on the call with the county executive last night. I still want to sign up for the Medical Reserve Corps, and I had a hard time processing it, and they'll walk you through that application, and that number is 845-486-3555, and that'll help you. If you have a question that you want to get directly out there, it's jryan at dutchessny.gov, JRYAN at dutchessny.gov. If you have a question, dial 0. Let me see if I can get through as many as I can. John was on the phone. If we're not still with him, he asked about pools opening. I know he's still there.
Yeah, that's me.
Okay, John,
yeah,
go right
ahead.
Here. Go right ahead.
I'm here.
Yep, go ahead.
Yeah, I'm in a condo, and I just wonder, am I going to be able to get near a pool before, say, July or something?
Not before July. Anil, do you want to talk to her? No, I mean, what we've said is, Anil, do you remember the timeline? I do, but if you want to jump in, what's the review process on pool permitting? Are you comfortable answering that, or would you prefer I do it?
I need a little bit more information to answer that.
Okay, that's fair enough. So I'll walk through. So summer camps, campgrounds, and recreation, including pools and lakes. Number one, if you are a seasonal community campground, RV camp, we are taking applications for permits now with the expectation that with protocols met, they could open the week of Memorial Day. So Memorial Day weekend, campgrounds, RV sites, and this is like tent camping and RV camping, and bungalows, meaning seasonal communities. Secondly, if you are a summer camp, meaning overnight, those kind of activities, we'll be taking those applications next. If you meet certain protocols, we would plan to permit those to occur at the end of June. And then if you are a private pool, lake, a municipal day camp, we are saying get those applications in, and your condominium location is permitted by us. And those would be permitted with the expectation to begin July 1. So that's the timeline that we're looking at for all of those activities, assuming we do not see growth in the hospitalization and severity of cases. So, Anil, you don't have to answer that one. I will. We have got about 10 more minutes to go. I want to obviously get through as many questions as we can. Jen has asked about special needs programming through the summer. I have asked the governor, and I will continue to ask the governor on every call and every session we have to make sure there are summer activities for those in special education and those with special needs. Already, the measurement for summer school for those with special education programming is 2 months of regression, meaning if you are out of school for those 2 months, will you regress? And if the answer is yes, the school district has to provide you those services. I am telling you right now, it is my belief that no child who has a special education program will not experience regression being out of a school setting since March of this year. So my position is, and I'd ask you to tell your state legislator and to reach out to the governor, we need a plan for summer education programming for those with special education plans, because it is critically important that they not be an afterthought by the state. I know that there are teachers doing remarkable work and parents who are really stepping up, but the state of New York needs to make sure that happens. Maureen asked if I thought schools will open in the fall. Assuming we don't see a spike and sort of this overwhelming of the hospital system, I believe schools would open in some venue or some fashion. Anil, do you want to give a 2-minute answer to what we think about schools opening in September?
I think, Mark, it's very important that, again, we sort of follow the metrics, and if everything is pointing to the fact that, again, widespread transmission in the community is not occurring, I think it's sort of optimistic. I'm going to hold that position that, again, we may be able to open schools in September.
Okay, and again, that would be with consideration for vulnerable populations and a care for those attending, obviously, and giving some latitude to those who may have underlying conditions or may just not be comfortable or appropriate to be in a setting like that if in fact the disease is as widespread as it has remained in this region. And I think that's a fair answer. Michael S. is on the line asking about price gouging. Michael, are you on the call?
I'm still on.
Go ahead, jump right in. You do sound like you're in a tunnel, but go ahead.
Well, I'm sorry, it's a speakerphone, but it's the only way I can talk.
Much better now. Go ahead.
Anyway, I'm curious if there's anything going on to address what supermarkets are doing with price gouging.
Well, if there is price gouging and you are aware of it, you can get to an enforcement link on the county's website, dutchessny.gov. We report all of those to the New York State Attorney General's office. Those are also shared with the enforcement units locally. And of all of the things that I am exceptionally comfortable ensuring that we enforce strictly, price gouging is highest among them, meaning that we absolutely don't want people taking advantage of the public. So if you're aware of a specific location that is engaging in it, please visit dutchessny.gov. We can get the appropriate resources available to enforce that as well. Amanda asked about pavilion rentals. If you're talking about county park pavilion rentals, we're not in a position to do that ahead of July 1. I'm sure that we'll have a process available, but again, there would be likely restrictions on the size of groups that we could accommodate at county parks, but that will be among the last of sort of the park activities that we would permit so that we can ensure that we're limiting transmission of the disease. I want to acknowledge that this month, for instance, this month has we've recognized teachers and nurses and corrections officers. May is Mental Health Awareness Month. It is also this is also National Police Week. This is ordinarily the time that Sheriff Butch Anderson would recognize law enforcement throughout Dutchess County. We'd pause in a service to acknowledge them. We're not able to do that as a group, but we are able to do that individually. So I ask you to join me in thanking and recognizing the men and women who serve in law enforcement. They've been put in some very difficult and challenging positions, heightened concern for domestic violence and those situations that occur in homes. Certainly the stress of having to be sort of enforcement for things that people don't ordinarily have to be encouraged to do. And of course, they continue every day to risk their lives in support of all of us. And so we're very, very grateful to the men and women who serve in law enforcement, and it's a good opportunity to say thanks and acknowledge them. Andrew's on the line. Andrew, programs for farmers and food banks. I think you're going to be about our last telephone call, but go ahead. We have about 5 minutes. Andrew, go ahead.
Thanks, Mark.
You're welcome.
My question is, because of the supply chain disruption, farmers have been unable to get their products to restaurants, so the federal government is starting a program whereby like $19 billion has been given to farmers to supply food banks. And my question is, will the Dutchess County website update this program as far as like the participating food banks and et cetera?
Well, we would make sure that the link for the farmers to access the support is available on the business tab of the DutchessNY.gov site. So when you go to our site, there's Dutchess Responds, there's COVID database, there's other resources that's escaping me at the moment, and then there's the business resources, and we'll be sure that link is there so that you can get more information about that. And I will tell you that we fought very, very hard. The first federal bill did not include assistance to agriculture and small farmers. I think it was an honest oversight. I don't believe it was intentional. But we fought very, very hard to ensure that changed and that there were resources available. The other I will tell you is that this year you should prepare for our senior picnics. We'll take on a different look this year, and one of the things we're going to be sure to do, and unlikely that we'll have large group settings, but we are going to purchase local. We have a contract with a vendor normally who buys local, but we're going to go right to some local agriculture and local restaurants to be sure that we're buying services from them as well. So I do want to remind you that you can visit your school district websites. I just want to mention that it's not just school budget votes this year, but there are candidates for school board. Visit your school district website for that specific information. In particular, any one of your specific school districts will be able to tell you who's running. It's an awkward year. Meaning that traditional campaigning isn't going on, which is, some of you may be happy about that, but nevertheless, visit your school district's websites for that information. Any last questions from those online? We'll take them. We're going to be live again with you on Friday on Facebook only. And then next Wednesday, we'll be online, Facebook as well. And then Wednesday, the 27th, we'll have a telephone town hall and Facebook Live as well. We're going to continue to give you updated information. I know that this is confusing, these benchmarks and these phases, and the governor's saying this, and we want to hear that. We will try to decipher it all for you. I promise you that we will try to translate it all for you as we proceed. I will tell you again, we are asking for some variance within the region so that we're not tied down to just the impacts of some of the larger counties. We are also asking for those two benchmarks to be looked at because, again, hospitalizations have been, at this point, relatively low. In fact, about 55 individuals, 60 individuals out of 500 capacity beds. We have not seen the spike in severity, so from our perspective, we are managing and have flattened that curve, and we believe that currently we believe it is safe to begin construction. This is not permitted yet. The governor has to sign off on these things, but we believe it's safe to begin construction and manufacturing next week. I've told you that it is perfectly acceptable for religious institutions to have vehicle services in their parking lots. We believe with drive-ins opening on Friday that it's perfectly appropriate for school districts to have commencement activities. We are waiting for that direction, but I'm telling you that I believe it is perfectly appropriate within the governor's expectation that those things are legitimate and can be safely managed. We're waiting on direction on some of those other business areas that you've all asked about. We think it's more than time to make sure that those phases include a clear direction on what businesses qualify, and we will continue to work as a region to roll out specific guidance to all of you. In the meantime, I do want to express our thanks to all of those who have been working throughout county government. They many times don't ever get seen, but our public health staff, those in departments, community and family services, public works. I'm going to get in trouble because I'm not going to get to all of them, but from those who help staff or IT departments to those who are working out on the front lines, Dutchess County government has been open, has been functioning, and has been working aggressively to provide response to your needs. And I want to thank our first responders, the ones that we traditionally thank, and rightfully so, and all the new ones, those at grocery stores and driving trucks, whether they be garbage trucks or food trucks. You're out there doing your best for all of us. I'm very, very grateful. Send your questions to us. Stay in touch with us. I will continue to try to decipher the information for you and give you what I know. I will be very honest about what we know. I will be very specific about what we know. And we will be very clear about those risks associated with what we know. and the next steps we have to take. I thank you all for participating tonight. We'll see you again on on Friday, and be safe, stay healthy, and be kind to each other. Thanks, everybody.